Hello everyone, happy 2024. Hi, my name is Robert Johnson, student from Nightingale College. The video I'm going to be performing today is going to be administration of oral medication. The reason for this video, I actually did this video, but I'm going to redo it because I was rewatching the video that I submitted and I caught a little mistake. So I'm going to go ahead and redo this video. I know it's going to be points subtracted, but it's worth it, right? Got to get it right. So first things first, the video I'm going to be performing is going to be administration of oral medication. I'm going to be using MAR number 3, right? So MAR number 3 has medications such as amoxicillin, right? That's going to be 250 milligrams of amoxicillin. It's going to be metformin, which is also glucophage. That is going to be 500 milligram of metformin, phenytoin, which is also Dilantin. That is going to be 100 milligram of phenytoin, ferrous sulfate. That is going to be 65 milligram of ferrous sulfate, and then a liquid medication is going to be acetaminophen, Tylenol, which is 500 milligram, 15 ml, I do believe. Yes. So first things first, just FYI, I know we see the patient here, but we're not there in the patient's room yet. So I'm just actually going over the my supplies, right? So I do have tissue here to wipe off the liquid medication later on in the video. You'll see that. I do have my medication on the table. Let's pretend like it's not open because I'm redoing the skill as I explained. Also, I do have hand sanitizer. So first things first, I'm going to clean my hands because I just got to the facility. And I am going to first check, compare the physician's orders to the electronic health records. And what I'm checking for, I'm going to be checking for the 6 rights. It's going to be the right patient, the right medication, the right dose, the right route, the right documentation, and the right time and the right documentation. So that's going to be the right patient, the right medication, the right dose, the right route, the right time, the right documentation. Those are the 6 rights. Everything looks good with the physician's order and the electronic health records. So now I'm going to check the MAR against the electronic health records and confirm the exact same things, the exact same 6 rights. Those look good with the medication. Now, from there, wash my hands because I will be handling the medication. So I'm going to check the medication against the MAR now. I'm going to be checking the medication for the right patient, the right medication, the right doses, the right route, the right time, and the right documentation also. So everything looks good on there. And because all that looks good, I'm going to gather my supplies. In this case, it could be the med card. I'll push it over towards the patient's room. I will knock on the patient's door, introduce myself, tell the patient while I'm there. Hello, Mr. Jones. How you doing? My name is Robert Johnson, student from Nightingale College. The reason why I'm here because there's a doctor's orders for you to have medication at this time, oral medication, and I'm here to assist you with that. But before we begin, I'll go ahead and wash my hands and provide you some privacy. All right, so I'll pull the curtain, right? Give the patient some privacy there. Curtain is pulled. Go to the sink, wash my hands, right? Everything is good. And then from there, I'll come back. Now that my hands are clean, I'm able to actually touch the patient. So I'm going to ask for the patient's ID band. Mr. Jones, can I please see your wristband, please? Okay, good. Can you please tell me your full name and your birthday? Right? So his full name is Walter Jones. Birthday is March 10th, 1964. Okay, thank you, Mr. Jones. And I would have to ask Mr. Jones about allergies. Mr. Jones, before we begin, do you have any seasonal allergies? Are you allergic to any food? Are you allergic to any medication? No? Okay. So Mr. Jones confirmed that he is not allergic to anything. So for that reason, I'm going to go ahead and put my gloves on because I will be handling Mr. Jones' medication. And Mr. Jones, if you have any questions about the medication, you just let me know. So the first one is going to be amoxicillin. It's going to be 250 milligrams of amoxicillin. I would explain to Mr. Jones that this medication actually has some counterindications, which is if the patient ever had hypersensitivity to this medication before, or if he ever had hypersensitivity to penicillin, or if the patient has severe renal impairment, that would be a contraindication. We would not give that medication for that reason. Adverse reactions, and side effects that we should be watching for would be a rash. If there's diarrhea, I would explain to Mr. Jones that high doses of this medication could actually cause seizures. So we would not be giving that medication for that reason. If you feel that your throat is closing up, or if you feel itchy or anything like that, please let us know, Mr. Jones. That could be an allergic reaction, right? Do you have any questions about that medication? No? Okay. Next one is going to be metformin, which is glucophage. It's going to be for type 2 diabetes. We're going to be administering Mr. Jones 500 milligrams of this medication. Counterindications for this medication will also be hypersensitivity, or it could be metabolic acidosis. I would explain to Mr. Jones that this medication also has some adverse reactions and side effects, such as lactic acidosis, abdominal bloating, diarrhea, and vomiting, right? Mr. Jones, do you have any questions about this medication? No? Okay. So then the next one is phenytoin, which is another name is Dilantin. That's going to be 100 milligrams of that. I would explain to Mr. Jones that this is used for the treatment preventing seizures, and also it is used for antiarrhythmic. So that's for your heart. So antiarrhythmic is going to be used for that. Counterindications of this one is alcohol. If the patient has alcohol in the system, we're going to actually hold that medication. We're going to also tell the doctor. If there's a alcohol use, and also if the patient has a alcohol intolerance, we're going to hold that medication. Also, if the patient has hypersensitivity, we're going to hold that medication. It is used I already explained what it's used for, but also if the patient, adverse reaction for this medication, I would explain to Mr. Jones that cardiac arrest could be an adverse reaction for this medication. Tachycardia can be an adverse reaction for this medication. Hypotension, nausea could be an adverse reaction for this medication. Also constipation. If you have any of those issues, please let us know, Mr. Jones. Also, you have any questions for that? No? Okay. So then the next one is going to be ferrous sulfate. It's going to be 65 milligrams of ferrous sulfate. This medication has its issues, but first the treatment of this one is going to be for deficiency. It's going to be for anemia, iron deficiency. But the contraindication of this particular one, which is unique, is that if the anemia is not from an iron deficiency, that is a contraindication. So we would not be giving this medication because it is used to treat a deficiency in iron, anemia, right? But if it's not connected to that, we would not give that medication, right? So one of the side effects of this one, very important for the patients to know, that he or she may have dark stool, constipation, epigastric pain, what else? Also dizziness. If you have any of those issues, please let us know as soon as possible, Mr. Jones. You have any questions for that? No? Okay. Now the last one's going to be liquid medication. It's Tylenol. It is used for fever and mild pain. This one's going to be 500 milligram and 15 ml. So the cup is going to be measured out to 15 mLs. I would explain to Mr. Jones that the contraindications of this one is that if the patient actually was drinking alcohol or anything like that, we would actually have to hold that medication. One of the side effects of this medication is hypokalemia, right? Hypokalemia, increased liver enzymes, also can cause constipation, right? So just to be sure, I went over the reason why doctors usually prescribe this medication would be for mild fever and for fevers and mild pain, right? So if you have mild pain, or fevers, the doctors will prescribe that medication for you. Do you have any questions about this medication? No? Okay. One of the things I do want to add about the acetaminophen, it also can cause skin rashes. If you feel that you're itching anywhere, please let us know and we'll have you evaluated by your doctor. Okay? Alrighty. And yeah, so no questions there. I have the medication, my gloves on. I confirmed with Mr. Jones that he does not have, he wants water, correct? Mr. Jones does want water with his medication. And although the medication is put off to the side, I didn't put it into the cup yet because I want to do one last check against the MAR. So I'm going to check this medication again against the MAR. That one looks good. Check it again through the MAR. It looks good. And this one looks good. And the last one looks good. So what I'm checking for, again, is going to be the 6 rights. It's going to be the right patient, the right medication, the right dosage, the right route, the right time, and the right documentation. Everything looks good, so I'm going to go ahead and start to put everything in a cup so I can administer, right? So all 4 tablets will go into the cup. And let's put that in there. Good. Let's put that one in there. Good. Alrighty. Just get that there. And just to reiterate, I did ask Mr. Jones if he has any allergies. He does not have any allergies. And so I have the 4 meds in the cup. Okay, Mr. Jones, here's your medication. I'm going to assist the patient. Oh, I'm sorry. Let me make sure the patient is in the upright position. Raise your bed up. Okay. Are you comfortable? Good. Want to make sure, we always want to have swallowing precautions to make sure the patient doesn't choke. So the head is raised up. Here you go, Mr. Jones. And there you go. Mr. Jones is going to take the medication. Okay. Here's your water. There you go. Drink. Okay, good. Would you like more? No? Okay. So then next, oral medication. Now on this one, it's very important when we're pouring oral medication. You want to keep in mind that this bottle is going to be used multiple times a day. So it's always important to pour away from the label. You want to protect that label, right? So it's important that you palm that label, right? After you confirm the right medication, of course. You want to take the top off and make sure the direction that you're pouring is away from the label. So the top, you want to place it upward. And then when you pour, you want to find 15 mLs and you want to pour at eye level, right? So you want to be able to see the actual medication go in at eye level. Okay, 15 mLs, 15. Good, that's 15. Now I want to get tissue. As I said, I have tissue for this reason. Wipe off the bottle. Now I want to put the top on. Right, wipe around the bottle. Good. And confirm there's 15. All right, here you go, Mr. Jones. Here's the liquid medication. Patient took the medication. And right, good. So now from there, I'm going to make sure that the patient's comfortable. I'm going to give Mr. Jones his call light. Ask him if he has any questions. If no questions at all, then I'll go ahead and start to clean up this area here. I will go and wash my hands. Hand hygiene, wash my hands. Call lights in place. The bed is at the lowest position. And Mr. Jones, I'll be back in a while to check on you to see if there's anything else I could assist you with. Now from there, I will leave the room. I'll go document that I give the medication, and then I'll come back and check on Mr. Jones in a little bit. All right? Thank you very much.